Well, first I want to thank Steve for making arrangements for me to come today. And I know most of you know the beginning of the story. So I was just going to talk a little bit about the details of my surgery and what happened before my surgery. And then, for about 20 or 25 minutes, and then after I take questions, and we do questions and answers, which for me is the funnest part. So if you can come up with some cool questions, that would make my day. So I'll start by my book ends. The ending of the book is when I get put on the face transplant list in December 2011. And that winter into 2012 is when I wrote the book. So I was on the list. I wrote it very fast with the publisher, the publishing company I had hired, because I thought for sure I would go for surgery as quick as the other face transplants did. The 3 other face transplant patients that Dr. Tomahawk had, the full faces, had gone within 3 months of being put on the list. So I thought that would be the same for me. So I did my book as quick as I could, but time kept going on and I wasn't getting called. So I slowed down on the book, and Dr. Tomahawk called me and said, it's going to be really hard to match you. You might be waiting 2 to 5 years. And I said, oh, wow, okay. So I just sort of put it in the back of my mind, because I also felt I didn't want to, I wanted to be patient. And the reason I wanted to be patient was I knew that there was a lady out there who didn't know it was her, who was living her life, somewhere near my age. So she was a younger person. And I didn't want to be impatient knowing that she had 6 months, a year, possibly less, and she didn't even know it. So I wanted to be patient for my donor. So I was. In the winter, so a whole year went by, December of 2012. My book was going to be published. We decided my book would be published March 1st of 2013. And I said, fine. So I was sort of getting ready for that. But I also was in the best place I had ever been in my life. I was the happiest. I was just hanging out, doing what I wanted to do, and nothing was really bothering me in my life at all. So I decided to take music lessons. My grandmother had taught me how to play the piano when I was young. So I wanted to go back to that. Had all this time on my hands. My book was done. I was just waiting for surgery. So that's when I called the Blue Mountain Guitar Center in West Lebanon, and that's how I met Sheldon in December of last year. And I was very happy that I was in a place where I knew someday I would meet somebody and have a relationship that I had no idea it was going to be then. And it certainly had taken me by surprise. And it actually, when I first started seeing Sheldon, actually just a few weeks before I ended up going to surgery, it was one of the first times in years that I started looking in the mirror again. Because, I don't see well, I don't look in the mirror, I didn't pay much attention to that. I had accepted all my disfigurement and all my scars. But then once I started seeing Sheldon, I thought, what is he looking at? What does he see? Because it's certainly not anything on the outside. So, but that really made me happy, because I really wanted to meet somebody before my face, because I felt strongly that if somebody fell in love with me with my scarred face, then they really knew who I was, and it wasn't about that. And I didn't expect it to happen, but it did. And that was as big as a gift as my face. So right after that happened, and that was going well, we went on a date. We were going to go out for Valentine's Day, which would have been our second date. And the day before, on February 13th, my doctor called me and said they had for the first time, they really had a potential donor. She was a little older than I had previously said. I wanted somebody within 10 years of my own age, and at the time I was 44. She was 56, and I said, well, that's okay, it doesn't matter now because I'd waited over a year, and if she's 56, then that's fine. So I was on my way to music lessons when he first called me to see Sheldon, because I still had music lessons. And so then that whole evening, my girls were both in college, so I was home alone. My mother and Sheldon were the only two that knew what was going on, and I was just waiting to see if it was really going to happen. And so I went through a couple of phone calls with Dr. Tonahawk through that evening, and at 11:30 that night, he said, it's a go. She matches you close enough if you're willing to take the risk, because I didn't have as good as a match as the other patients had, and I knew that going in, and the family had consented, so it was up to me, and I said yes. So I had to be in Boston by 4 o'clock in the morning, and this is right before midnight, and for a little while I was shaking and nervous, because I was, it's so exciting and so surreal, that it was also so scary to think that, okay, they're going to take my face off and they're going to put somebody else's face on. It was very sci-fi to me, so weird. But I really felt it was, and I felt all along that it was a viable option for me, because I had been very uncomfortable with all the scarring in my neck. And I couldn't move my face hardly at all prior to my face transplant. So it was well worth it to me. And I called my sister. I waited until midnight, 12:30 to call her. And she came up, and she drove me to Boston in the middle of the night, and I talked to Sheldon. He was away, but I talked to him on the phone, and it was just a real quiet ride to Boston. A real clear night, cold, and it was Valentine's Day. And to me, Valentine's Day was, the day of gifts, the day of love, Valentine's Day. And I just thought, well, of course this is going to work out because it's Valentine's Day, and this is my gift. So to surgery I went, and I woke up. Let's see, the surgery is 15 hours, so it ended that night, that I didn't wake up until the next day, Friday afternoon. And I woke up, and the first week was very rough. I was quite sick, and they didn't allow me to eat, and so that was the roughest. My face was so swollen, and I now had eyelids, so I couldn't see. I couldn't see at all because it's just too much swelling for my left eye to see. So I was completely blind for the first 10 days. But that was okay because I actually expected that. So that was okay. And I had, my family came down to visit me, and Sheldon came down to visit me. And everything was going well. And a few weeks later, they published my book early, and they did the press conference to say my surgery had been done. And 3 weeks into it, they started talking about me going home. I had some rejection problems, but it looked like it was clearing up, and they started making plans for me to go home, which it was exciting. But as soon as that started, my rejection came back full force, and my face turned very bright red, and like I got sunburned, and was peeling, and was swelling, and it didn't look. To them, they were concerned. So about a month into it, my Dr. Tolnahak came into my room one morning, and he didn't do his usual thing. He sat down at the foot of my bed, and it was 6 o'clock in the morning. He came in alone, which wasn't typical either. So I knew something was up. So I sat up in bed and I said, "What's going on?" He said, "Well, you know, Carmen, we've tried almost all the options with all the medicines, all these different kind of medications through your IV, plasmapheresis, which is a procedure they do through these big lines in your groin, and all these different kinds of anti-rejection techniques." And he said, "None of them are working, and your biopsies are like biopsy stages were near the top of full rejection." And he said, "I don't know what we're going to do." And I said, "Well, are you talking about taking off my face?" And he said, "Well, I think that night happened." And I said, "No, I'm not doing that." I said, and I started to cry. And I said, I know I'm only 44 years old. I said that I've lived 3 lifetimes. And I know in my heart that I don't have to go back to that scarred face. I've already overcome that. I don't have to go there. I said, "So you do what you have to do." And he said, "Well, the only option left is this big, heavy chemotherapy type of drug that has a 2 to 10% risk of death." And he said, I don't necessarily know if this is going to help, and it might hurt. Because they hadn't treated anyone with my kind of issues in the past, so it was all new territory for them. So I said, "Well, then I want that drug. If that's the only option left, then I'll take that risk of death and I'll take the drug." So what ended up happening was that he gave me just half the dose. And the half a dose with some other combination of drugs and procedures got a hold of my rejection, and it calmed down within days. And I started to make the turn the other way. And 2 to 3 weeks later, I went home, and I haven't had any signs of rejection since. So the recovery has been a lot longer than I thought it would be. I've had numerous surgeries after the face transplant that had to be done, nip and tuck things. I had my eyelids done, those kinds of things. So I'm just starting to feel good now about 6 months later. So that I must say, most of you know that I've met the donor's daughter, Narinda. She's 30 years old. She's a sweetheart, and I just feel so blessed to her and her mother for the donation. It's changed my quality of life so significantly, even though it didn't save my life, and of course her other organs saved other people's lives. I certainly feel like I have an equal gift in receiving her face. So to me, it's been the biggest blessing, and it occurred right on the right day, at the right time in my life, and it's just been heaven sent in so many ways. So if any of you have any questions about the surgery or about anything, even from the past, I've never had a question I won't answer. So anybody have any questions?
Carmen, I'll break the ice.
I think everyone's a little careful. This is uncharted territory for a question, but I am very curious to know what you can feel.
Well, now, when I first had surgery, I couldn't feel anything. You're totally numb, and you only can feel like pressure. But a few months later, I would get all this like if I touch myself here, I'd get all this tingling. And I'd touch myself here, and I'd tingle over here. Or he'd touch me here, and I'd say, "You're on my chin." And he'd like, "No." So everything, I couldn't figure out where anything was. But over time, it's getting more and more sensitive. So I still have a lot of the tingling. And right now my lips feel something really hot when it's not, or really cold when it's not. So they're just super sensitive now. But it's all getting better and better. I can feel stuff on my face now I never could before. So the sensitivity is, I couldn't feel the top of my skin, but now I can. So that's all, it's a very slow process. But I can move the left side of my face. I never could move the left side of my face before surgery. So, and that's muscles that weren't even mine, because my muscles were gone on that side. So, and I can blink my eye just enough to keep the lens in, so that's very good for my left eye. So
you're slowly learning how to move her muscles.
right, her muscles, her nerves,
Wow.
some of her nerves, because I don't know if you remember that my skin, my face was so thin because I had no subcutaneous tissue. So all the nerves and muscles and all that was gone from my face. I just had basically a scar on the top. So they renewed everything that didn't work. I did have muscles on my right side that did work, and nerves that did work on my right, some on my right side. So they basically knocked out what worked of mine, they kept. What didn't work, they replaced with hers. Yeah.
How many people in the world have had that done?
Well, I think on like 25th-ish, that of those 25 people, only I think a dozen had full faces. Dr. Tomahawk had done a partial face transplant in 2009, and then he did full faces in 2011, in knee in 2013. On the 5th full face in the country, on the 7th face transplant in the country, being the 5th full face. Yeah.
You, what is your eyesight capacity?
I'm totally blind in my right eye. I lost all that vision after my synthetic cornea in 2009. And my left eye, I had a second synthetic cornea put in my left eye in December of 2009, and that actually improved my vision to about 20/350 in my left eye, which means everything's blurry, but I can see color with the right lighting. I can see color, and I can usually avoid furniture, but not if it's too dark, not if the lighting's not right. I'm dull in a china shop.
I have both eyes and I'm a bull in a China. Are you a candidate for eye transplants? Would you be
Well, you know, they've never done eyeball transplants. I don't know if that can possibly be done. I lost vision in my right eye. I had a healthy retina, and I had a complication from the cornea transplant, and it ruined my healthy retina. So if the technology improves and they had something they could do with my retina, I could have full vision in my right eye. That's sort of my hope someday, is that they'll come up with something because my retina got all scarred from the surgery, and I went blind within 6 weeks. So I'm hoping that technology over the next 20 years would change that for me. But right now, I'm fine with what I have.
You said you were taking music lessons. That's how you met Sheldon.
Yes.
What instrument do you play?
He's teaching me piano, and I also picked up the banjo, because I think that's the coolest sounding instrument, is the banjo. So I'm learning both of them. Although I played the piano when I was younger from my grandmother. Mm-hmm. So he's teaching me a lot of music theory that I never learned. So that's challenging.
Carmen, has your doctor asked you to talk to any other patients who are waiting for a transplant?
Not at this time. I actually don't know if there are any. I don't know about the funding. I think I was his last patient when it came to the Department of Defense funding for the face transplants. So I think now, I don't know, I think there'll probably be other funding, because the whole reason for the face transplant, the government paid for it because of the military in Afghanistan and Iraq getting blown up and having such scarred faces. The Department of Defense paid for the face transplants to see if it was a viable option for the military people once they get home. The ones that had, very damaged, disfigured faces. So that's the whole reason that all came about, and I just happened to fit into that.
Do you know if they made a decision about whether they considered it a viable option?
I don't know. I don't know if they made that decision. I think they must have made it, or maybe they don't retort it, but, the first, it's been over 2 years since Dr. Tolnahawk did Dallas and Mitch, and they're doing great. They're doing really good.
Dallas and Mitch, I take it, were veterans?
Those were the two. None of the face transplants were veterans. He was just doing regular citizens that needed it done prior to any of the military people, I guess.
A very basic question over there. Well, I think you just kind of answered my question. I just didn't know how you got burned, but you were in Afghanistan?
No, not me. No, that was the reason for the face transplants to come about. I was actually attacked by my ex-husband in Thetford in 2007, and he doused me with the chemical industrial strength lye. And I was over 80% burned, and my whole face and head and neck were all burned.
Well, I want to say one thing. Your skin looks beautiful.
Yes, thank you. My donor was 56 years old. Her name was Cheryl, and her daughter tells me that she was very into keeping her body and her skin and everything so nice and all of that. She had a facelift a few years ago, and so even though she was 56, it's not going to make a difference, to my age. I'm 45 now. But over the next year, you'll see my face settle in, like my forehead has. My forehead feels like my old forehead. So it'll just go right down my neck, and it'll just take probably another year or so, and then I'll look very normal. Except for, of course, my eyes, but, that's okay.
I saw that you had spoke to a family that lost both parents in a very tragic situation, and you provided a lot of, comfort to their grown children. Have you ever spoken to any other victims of domestic violence?
No, well, not individually. I actually knew their mother. She worked at the East Thetford bank when I got hurt.
I see.
So she knew my family. I knew her. My family knew her. She was always very good to me. And Valentine's Day one year in 2009, she came up and brought me roses. She was just a sweetheart to me. I didn't know, although I knew her pretty well, I did not know she was in an abuse situation at the time. So when that murder-suicide happened in Fairleigh, and it was her, I heard from her daughters after I went to the funeral. And I had already scheduled to speak at the high school, the local high school, which those girls went to high school there. That was all set up prior to that happening. I was already scheduled to speak, and they knew I was speaking, so they came down to hear me. And she would have done the same thing for my kids had it done me. So that was easy. That part's very easy for me. And anybody, who comes into my life needing that kind of assistance, that's very easy for me to provide. So I was, more than happy to do that.
Carmen, I just wanted to remind everybody that you have some books here. Your books, so if anybody wants to purchase a book, they can, about the whole ordeal. And I wanted to ask you one final question. It's more of a philosophical question. many of us as businesses have mission statements that we write. And you had to obviously rewrite your mission statement in life. If you could tell us your mission statement, what would that be?
Oh, my mission statement.
That's a good one for you to think about.
Well, I certainly see life very differently. I do not have the same perspective I had prior. So I live my life as if everything happening, everybody I meet, everybody that says whatever they say, is all something for me to hear. Something for me to hear, something for me to know, something for me to understand, something for me to grow. And that's how I live, as aware as I can, and I try to stay in the moment, every moment, all day long. And that's what I do.
I want to thank you for your coming to speak to us and for your bravery.
Thank you. Thank you very much. Thank you so much. Yeah, thank you. Thank you.
Yeah, how much is the book?
The books are $20.
Okay, $20.
It's a great read.